This is the study guide for OB and Peds, Nursing 250, I believe it is, and it's several different chapters. I don't have the chapter numbers. Start off with preconception counseling. Activities that promote healthy mother and fetus must begin between 17 and 56 days after fertilization. Intake of 400 micrograms of folic acid to decrease neural tube defects and encephalopathy. Intimate partner violence. It is not random or constant, but occurs in repeated cycles. Forms of intimate partner violence include physical abuse, emotional abuse, sexual assault, isolation, and controlling. It's a three-phase cyclic pattern. Phase 1, period of increasing tension. Phase 2, the period of actual battery. And Phase 3, the honeymoon phase. Signs and symptoms that this might be going on: overuse of health services, vague complaints, missed appointments, unexplained injuries, untreated serious injuries, injuries not matching the description, partner never leaves the patient's side, partner does the talking. Alrighty, here's some definitions. Causes of amenorrhea, which is a lack of menses. Amenorrhea is the absence of menstrual flow. Amenorrhea is most commonly the result of pregnancy. Duh. Other causes include anatomic abnormalities, endocrine disorders, diabetes, phenytoin or Dilantin use, the same thing, phenytoid or Dilantin, diabetes, illicit drug use, eating disorders, strenuous exercise, emotional stress, and oral contraceptive use can all cause amenorrhea. PMS. Ovarian function is necessary for PMS to occur. It does not occur during puberty, after menopause, or during pregnancy. Premenstrual dysphoric disorder, PMDD, is a diagnostic term for severe PMS. PMS symptoms occur in the luteal phase and resolve within a few days of menses. A symptom-free period occurs in the follicular phase. Diet and exercise can provide relief of PMS symptoms. Avoid smoking and limit sugar, salt, red meat, and caffeinated beverages. All the good stuff, huh? Menorrhagia. 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 Hopefully I'm pronouncing that correctly. Or hypermenorrhea. Excessive bleeding, either the duration or the amount of bleeding. Causes are hormonal disturbances, systemic diseases, neoplasms, infection, and contraception. Treatments include, the medical treatments can include Premarin IV or surgical treatments. And I believe Premarin is a progestin. We'll figure that out here in a minute. Alrighty, that was for hypermenorrhea or menorrhagia, excessive bleeding. Dysfunctional uterine bleeding, DUB. This is a subset of abnormal uterine bleeding. Most frequent cause is anovulation, where the ovaries don't release an oocyte. There's possibly too much estrogen being in the system continuously. Obesity and hyper or hypothyroidism can cause dysfunctional uterine bleeding. Treatments can include conjugated estrogen, that's that Premarin I just talked about. If the bleeding continues, a Foley catheter is put into the cervical ooze, I believe it's pronounced, and it's inflated. The balloon is filled with saline until the bleeding stops. A D&C may need to be done if the bleeding doesn't stop 12 to 24 hours. Eventually, the patient will be placed on progesterone, and then the patient will be placed on low doses of oral contraceptive pills for 3 to 6 months. That was for dysfunctional uterine bleeding. Candidiasis. I know I'm butchering these terms. A yeast infection from Candida albicans. That's terrible. Causes of candidiasis can be diabetes, increased sugar in the diet, corticosteroids, antibiotic therapy, and pregnancy. Symptoms, one of the major ones is vaginal pruritus, physical exams, and the pH of the vagina for diagnosis. Over-the-counter drugs for comfort. Fibroadenoma. The cause is unknown. We're talking about in the breast now. It's a benign, solid, encapsulated non-tender mass, normally non-tender, I should say, most often found in the upper outer quadrant of the breast. Surgical excision of the lump if suspicious or severe symptoms occur. Fibroadenomas do not respond to diet or hormone therapy. Metorrhagia, bleeding that occurs at a time other than normal menses. Metorrhagia, bleeding that occurs at a time other than normal menses. All these different terminologies. Causes can be, I need to back up. If they're bleeding at 14 days or just spotting at 14 days, that it can be considered normal at 14 days. That's at the ovulation time. Causes: oral contraceptive pills, IUDs, vaginal infections, and cysts. Treatment for metorrhagia, which is bleeding that occurs at a time other than normal. Adjustment in their oral contraceptive pills, removal of any foreign objects, removal of cysts, and treatment of vaginal infections. Pelvic inflammatory disease. Another term for that is salpingitis, infection of the uterine lining. Gonorrhea and trichomatis are the two biggies there, gonorrhea and trichomatis, normally acquired just after a menses. It's the single most serious infection encountered by women. Spread of the microorganism from the vagina to the upper genital tract. There can be, this is for chronic pelvic pain, and again I'm talking about pelvic inflammatory disease. Treatment is IV antibiotics at the hospital. Place these folks in a semi-Fowler's position for comfort. They need lots of rest, and they're at risk for infertility, and they're also at risk for ectopic pregnancies. The human papillomavirus. It's the most prevalent STI, sexually transmitted infection, in ambulatory care. This was previously called genital warts. The warts can be removed with a laser. Pregnant women are susceptible to this. Vaccination at age 11 for for boys and girls. It's a set of 3 injections. There is no therapy to eradicate this virus. Physical inspection of the patient, a pap smear for diagnosis, meds for discomfort, and education. They need to have education about how to prevent it, spread of it, etc. Endometriosis, characterized by the presence and growth of endometrial tissue outside of the uterus. The tissue may be implanted on the ovaries, anterior and posterior cul-de-sac, and on the round ligaments. A cystic lesion of endometriosis is sometimes described as a chocolate cyst because of old blood. Signs and symptoms of endometriosis are pelvic pain, dysmenorrhea, dyspareunia, which is painful intercourse, and bowel distress. Pain control for women with primary dysmenorrhea associated with abnormally increased uterine activity and is caused by the myometrium contractions, not caused by underlying pathology. Usually appears within 6 to 12 months after menarche when ovulation is established. Pain control includes heat, massaging the lower back, exercise, effleurage, pelvic rocking, NSAIDs, and oral contraceptive pills. Risk factors for STI, sexually transmitted infections: if they're sexually active, if they have many partners, different in same sex, and whether they're using protection or not. Some common bacterial sexually transmitted infections, this is bacterial, are chlamydia, gonorrhea, syphilis, chancroid, lymphogranuloma venereum, genital mycoplasmas, and group B streptococci. Some common viral STIs are HIV, herpes simplex viruses 1 and 2, cytomegalovirus, viral hepatitis A and B, and human papillomavirus. Boy, I can't read or talk tonight. HIV testing. HIV infection is usually diagnosed by using HIV-1 and HIV-2 antibody tests. There's an enzyme immunoassay screening test that can be done. A Western blot test or an immunofluorescence assay test can be done. A rapid method for HIV can now be obtained by a finger stick or venipuncture or oral fluid sample. Hepatitis A, B, and C. Hepatitis A is acquired primarily through the fecal-oral route by ingestion. Hepatitis A, fecal-oral route by ingestion of contaminated foods such as shellfish, polluted water, or person-to-person contact. It can be transmitted during sexual activity. This hepatitis A characterized by flu-like symptoms, malaise, fatigue, anorexia, nausea, pruritus, fever, and right upper quadrant pain where your liver is. Hepatitis B is an sexually transmitted infection and is most threatening to the fetus and the neonate, transmitted by blood, saliva, sweat, tears, vaginal secretions, and semen. Sharing of needles, perinatal transmission, amniotic fluid, and breast milk, characterized by the same flu-like symptoms as hepatitis A. And then finally, hepatitis C, that's the most common blood-borne infection, transmitted through exposure to blood, intravenous drug use. There's no vaccine for hepatitis C. Transmission of hepatitis C vaccine through breastfeeding has not been reported. Okay, let's talk a little bit about tamoxifen. Tamoxifen, that is a cancer medication that's given orally, 20 to 40 milligrams. It prevents the natural hormones from attaching to receptors. This is used for breast cancer. Treatment of metastatic breast cancer and treatment of breast cancer in postmenopausal women after breast cancer surgery and radiation treatment to reduce the incidence of breast cancer in women at high risk. Some of the side effects of tamoxifen can include nausea, hot flashes, vomiting, bleeding, deep vein thrombosis, and increased risk of endometrial cancer and stroke. Breast cancer postoperative patients. These people, they need some real help. Special precautions must be observed to prevent or to minimize lymphedema of the affected arm, whichever side the breast was operated on. Vital signs: you never want to apply the blood pressure cuff on the affected arm. Early arm movement is encouraged. Any increase in the arm circumference needs to be reported. Dressings and drainage tubing changed every 8 hours or more if necessary. Women are asked to alternate between the unaffected side and the back only. They don't turn over on the side that was operated on. They're encouraged to cough while the nurse or the patient themselves apply support to the chest, and they need to deep breathe every 2 hours. The nurse should check breath sounds every 4 hours, range of motion of their legs, parenteral fluids until adequate oral intake is possible. And they also probably should be referred to the American Cancer Society's Reach to Recovery program to have a trained visitor go to their home. Some more things about breast cancer post-op. Exercise is tolerated. They can alternately clenching and extending of fingers, wrist, elbow, abducting the arm, raising above the head. This is once they get home. A wand exercise, elbow winging, shoulder blade stretch, shoulder blade squeeze, side bending, chest wall stretch, shoulder stretch. That's for patient teaching for a mastectomy. Factors that affect fertility for the female. Well, you've got the ovarian factors, anovulation, the lack of producing an ovum, and that can be caused by increased prolactin. You have tubal and peritoneal factors, developmental anomalies, inflammation in the tube, adhesions, or endometriosis. Then you got uterine factors. You have anomalies of the uterine, endometrial and myometrial tumors and scar tissue. Or finally, vaginal cervical factors, infections, inadequate mucus, isoimmunization, which is development of sperm antibodies. Factors that can affect the male fertility: structural and hormonal, undescended testes, hypospadias, which is where the urethra is under the medius, and a varicose, which is varicose vein, obstructions, low testosterone levels, hypopituitarism, endocrine disorders, testicular damage from mumps, retrograde ejaculation, and that's where the semen is ejaculated back into the bladder and not out through the penis. Substance abuse, smoking heroin, marijuana, methylqualone, impotence from alcohol or antihypertensives as well, sexually transmitted infections, exposure at the workplace, high temperatures to the scrotum, nutritional deficiencies, anti-sperm antibodies, and idiopathic conditions. Quite a bit to go yet, unfortunately. Use of injectable progestins, such as Depo-Provera, for birth control. They're given sub-Q or IM in the deltoid or the gluteus maximus. They only have to be administered every 11 to 13 weeks. That's the big plus there. They need to be initiated during the first 5 days of the menstrual cycle. Don't massage the site after you're giving it. Some of the downsides, people that use Depo-Provera may lose significant bone mineral density, and so they need to be counseled about calcium intake and exercise. Smoking and infertility. Smoking impairs fertility in men and women. It may reduce the age for menopause. It increases the risk for osteoporosis after menopause. Secondhand passive smoke contains similar hazards. IVF, in vitro fertilization. The woman's eggs are collected from the ovaries, fertilized in the lab, and transferred to her uterus after normal embryo development has occurred. Indications for this are tubal disease or blockage, male infertilities, and endometriosis, infertility, cervical factor. Medications that may decrease the effectiveness of oral contraceptive pills. Anticonvulsants, antifungals, anti-tuberculosis drugs, and anti-HIV inhibitors. Again, anticonvulsants such as barbiturates, phenytoin, phenobarbital, systemic antifungals, anti-tuberculosis drugs such as rifampicin and rifabutin, and anti-HIV inhibitors. Medical abortions, the purposeful interruption of pregnancy before 20 weeks of gestation. After 20 weeks labor, they must be induced to expel the baby. The first trimester, what they're going to do for an abortion, they'll have either surgical aspiration, they can use methotrexate and misoprostol, or they can use mifepristone and misoprostol. That's in the first trimester. The second trimester, they're going to have to do a dilation and evacuation, or they can use prostaglandins or hypertonic and uterotonic agents. All right, one more time. First trimester, surgical aspiration, methotrexate and misoprostol, or mifepristone and misoprostol. Second trimester, that's that dilation and evacuation. They'll use prostaglandins, or they'll have hypertonic and uterotonic agents. Moving right along. Autosomal recessive inheritance. Disorders in which both genes of a pair of genes must be abnormal for the disorder to be expressed. Heterozygous refers to having two different alleles for a single trait. Individuals have only one variant allele and are unaffected clinically because their normal gene overshadows the variant allele. An allele is one of two or more alternative forms of a gene that arise by mutation and are found at the same place on a chromosome. So it's a disorder in which both genes of a pair must be abnormal for the disorder to be expressed. That's autosomal recessive inheritance. The umbilical cord. There's two arteries that carry deoxygenated blood from the embryo to the chorionic villi, and there's one vein that returns the oxygenated blood to the embryo. That's kind of backwards of what you'd think it'd be. The umbilical cord supplies the embryo with nutrients and oxygen. There's connective tissue called Wharton's jelly that prevents the compression of the blood vessels and ensures continued nourishment of the embryo. The placenta. It forms at implantation. It's a means of metabolic exchange, respiration, nutrition, excretion, and storage. It supplies endocrine hormones, the HCG hormone, the human chorionic gonadotropin, and the human chorionic gonadotropin that can be detected in the maternal serum by 8 to 10 days. That's the basis for pregnancy tests. It also secretes human chorionic somatomamotropin, or HCS, and then also progesterone and estrogen. Multifetal pregnancies. Monozygotic twins, there's 1 ovum, 2 sperm, 2 zygotes, 1 placenta. Dizygotic twins, there's 2 ovum, 2 placenta. They can be the same or opposite sex. Here's some milestones. We're going to start talking about infants and toddlers. Weight gain of infants, 6 months, 12 months, related to birth weight. By 6 months, the birth weight should double. By 1 year of age, the birth weight should triple. Height increases by 1 inch per month for the first 6 months, and then there's growth spurts. Actually, it's growth spurts throughout. Fine motor development for the 2 to 3 months. A 2 to 3 month old infant, the hands are mostly open. They'll show a desire to grasp an object. They can hold a rattle, but they don't reach for it. They'll clutch their own hands. At 5 months old, there's no head leg any longer. Their back can be straight, and they can turn over from their abdomen to their back. When they're supine, they'll put their feet in their mouth at 5 months old. Milestones such as rolling over and sitting without support, pulling up, walking, etc. From birth to 4 months, they exhibit involuntary reflexes. They'll have increased hand-eye coordination and a grasp reflex. From 4 to 7 months, they can roll over, sit briefly, grasp objects, push up on hands, knees, and crawls backwards from 4 to 7 months. 8 to 12 months, they'll crawl, creep, stand holding on to furniture, or stand alone. They'll have the pincer grasp by 8 to 12 months and begin to understand simple commands and phrases. Object permanence. Second major accomplishment. It is the realization that an object exists even if it's out of the visual field. Recommendations regarding giving an infant cow's milk not before 12 months of age. If you're introducing solid foods, that's recommended at 6 months. Rice cereal is thin. The GI tract has matured by 6 months. Tooth eruption facilitates biting and chewing. Head control is well developed, and the extrusion reflex has disappeared by then. Teething it should begin from 6 to 10 months. The age of the child in months minus 6. So if they're 8 months old, minus 6, that would equal 2 teeth. If they have a temperature of 38 degrees, which would be 100.4, you probably should give the doc a call. Cold is soothing. Don't use powders or aspirin on their gums. They can aspirate and get infections. Golly, we're almost done here. Okay. Infant shoes. Infants, hard-soled and flexible shoes are detrimental to the infant. A normal arch isn't determined by the height, but by the proper alignment of all the bones and development of the surrounding musculature. The main reason for shoes is protection of the foot, not support. Car seats. I don't know if we're going to have this or not, but a rear-facing infant seat should be used for infants less than 1 year old, weighing less than 20 pounds, and it should be in the center of the rear seat. Toddlers, 12 to 36 months as a toddler. Locomotion and eye-hand coordination are mastered during this time. If we're talking about tertiary circular reactions, this is from 12 to 18 months. Discovery of new ways to produce the same consequence or obtain the same goal, such as the infant may pull a pillow towards him in an attempt to get a toy resting on it. Okay, that's tertiary circular reactions. Typical play of toddlers from 12 to 36 months. Parallel play. The toddler plays alongside, not with other children. Imitation play. And tactile play. Push-pull toys, tricycles, etc. Temperaments. There's 5 types. This is in the infant. Difficult, they need structure. Highly distractible, high activity, safety is a concern for them. Slow to warm up, those infants have a fear of change. I shouldn't say infants, toddlers, and easygoing. So there's different types of temperaments: difficult, highly distractible, high activity, slow to warm up, and easygoing. Injury, let's see, use of fluoride supplements. Every child should have an oral health exam by the age of 12 months. Fluoride supplements should be considered for children over 6 months whose drinking water is deficient in fluoride. Fluoride mineral is found in water, foods, or drinks in which fluoridated water was used in the process. Injury prevention for toddlers. You got to watch motor vehicle injuries, car seat safety, drowning, burns, poisoning, falls, aspiration and suffocation, bodily damage, and anticipatory guidance. Okay, go through these again tomorrow on your way to school when you get up, and you'll do well.